Welcome to the Health Channel, all health, all the time. I'm Kathy Buccio, coming to you from the Baptist Health South Florida studios. When you hear the word chiropractor, do you think of lying on a table, having your neck or your back cracked? You're right, but the chiropractic doctor can offer you so much more. On our Living Well show, we are exploring chiropractic medicine with Dr. Sandra Doman, a chiropractor at Miami Sports Chiropractic and Yoga Center. Welcome to the show. It's so great to have you.
Thanks for having me.
And you brought the spine.
I did, my friend.
I like that, our other guest here.
Yes.
So most people I know think of a chiropractor as a person who cracks your bones, maybe gives you a massage, aligns your back, but there's more to it than that. So what is it that you do?
So a chiropractor is a primary care limited physician who specializes in the diagnosis and treatment of neuromusculoskeletal conditions and the effect of these conditions on the overall health of the body. And so the cracking sound that you mentioned, while you can hear the alignment of the joint being realigned, and that's the modality that we're best known for, chiropractors are also trained in identifying not just the physical stress, but also the nutritional stress and the emotional stress that makes people unwell.
So basically an overall component of health.
Yes.
Amazing. So how did you get into this field?
So I'm a third-generation physician. My grandfather was an internist, and my father is still a practicing gastroenterologist outside of Washington, D.C., where I used to be from.
Okay.
And when I was in my first career path, which was in corporate America, what I was taken by is that people were unwell and they weren't having a good quality of life. So when I went to look back to getting into healthcare, I decided that I wanted to operate at a physician level, which is diagnosis and treatment, but I wanted to be able to help people without drugs and surgery.
So then what isn't considered chiropractic care?
So anyone who's not a licensed chiropractic physician, so chiropractic care is, what's not chiropractic care is anything that is provided by anyone other than a chiropractor. So anything that is self-cracking sounds or anything done by a massage therapist. Yes, which is perfectly safe.
Okay.
That is not chiropractic care, because chiropractors, again, focus on the diagnosis and the removal of something called the subluxation. And these are fixations in the spine that also interfere with healthy balance of the nervous system. Okay,
and just a reminder, if you have a question for the doctor, please call in using the toll-free number this hour, 855-796-4475. We're here to help you and answer all your questions. So the term chiropractic breaks down hands-on therapy, correct? So what can you tell us about then chiropractic care and its meaning, its history, and how it's evolved to what it is today?
That's right. So chiropractic does mean by hand, and while manual hands-on therapy and spinal manipulation has been around for thousands of years, over 100 years ago, a man named D.D. Palmer discovered the art, science, and philosophy, the system that we follow today, that is chiropractic. And so we operate at a physician level to diagnose and manage these conditions.
Amazing. So are they covered by health insurance or included sort of in a medicine treatment?
Yes, so all health insurance covers chiropractic care. It's in VA hospitals, it's covered by Medicare and Medicaid, but of course you want to double check with your insurance to find out if you qualify.
You also mentioned something before. You said that you're a chiropractor at the physician level. So is there a difference as to chiropractors that are not?
No, so all chiropractors have to sit for a national board exam. We're governed by the NBCE, and then we also apply for separate state licensing. But there are lots of healthcare practitioners who are not designated as a physician legally when they're seeing patients.
So what type of education does that entail?
That's another great question. So it's about 4,500 hours of classroom, lecture hours, clinical lab experience, as well as an internship, which rivals the intensity and thoroughness training of a medical doctor or an osteopath. However, when it comes to the treatment portion of the show, we do not do drugs and surgery. We go to hands-on care and lifestyle factors.
Okay, and then you follow the same regulations and ethics as MDs and DOs, correct?
Absolutely.
Okay, I can't wait to get more into this. Okay, so now that we talked about a little bit about the training, what goes on, it's 4,500 of extensive training. So at what point, what are people seeing chiropractors for, and when do they come see a chiropractor?
I would say that the most common reason that people come to see a chiropractor is pain, the thing that we're best known for, again, the spinal manipulation. People come to us for anything from low back pain to neck pain and headaches. And I would say that we not only excel in these areas, but they're extremely safe. And the Consumer Reports shows that for all physicians and healthcare practitioners that see people for these conditions, that chiropractors rank #1 with satisfaction.
Can I ask you, what then is the difference between a chiropractor, let's say, and an orthopedic?
So a medical doctor, orthopedic, can diagnose and treat with drugs and surgery. So for example, you come in with low back pain,
okay,
and it's not a fracture, tumor, infection, cancer, any of these red flag items that do need to be managed by a medical doctor.
Absolutely.
And the treatment options that they have in their office are either pain medication, an injection, or a surgical procedure. And so I would say that's probably the biggest difference, is how we decide to treat patients in the end.
And there are a lot of benefits to seeing a chiropractor, and let's look at these to get a sense of the range of patients that you treat. So first off, back or neck pain, which is probably the most common, correct?
Yes.
Okay. And if you can talk to us about the rest as well. These are patients that you see and you treat them for headaches, insomnia, you said as well?
Yeah, indigestion, any general injuries, heart problems, and you might be wondering why a chiropractor would see a patient for something that's not musculoskeletal. And so you'll see here on this spine that we have here, and some infographics we're going to look at later, is that when you see a chiropractor, it's not just about removing musculoskeletal pain, but we're talking about the intricate relationship with what the spine encases, which is the brain, the spinal cord, and all the nerves that communicate with the nervous system. So if you or someone you know has been to a chiropractor for something like heart issues, asthma, breathing problems, indigestion, infertility, in children, I see children with chronic earaches, we're talking about aligning the spine and removing communication interference and soothing the nervous system and the communication between the brain and the rest of the body.
That's absolutely incredible. So then a lot of these ailments are tied to a disalignment, would you say then?
So we call them misalignments.
Misalignments.
Right, because unless it's a life-threatening disease or a fracture or something that truly needs a medical intervention, we're talking about a loss of balance in a naturally balancing body. That's called homeostasis. And so a chiropractor looks for these imbalances in the spine and the nervous system and is able to quickly and safely correct them.
So what should someone look for when selecting a chiropractor?
My #1 tip for finding a good chiropractor is by word of mouth.
Okay.
So to speak with friends, family, community members who have seen a doctor. There's, I think, 70,000 chiropractors in the country, and to go based on personal referral. Here in the state of Florida, you can go to the Florida Chiropractic Association's directory to find a member there. And then it's important that you want to go visit their website as well to see if you have something in common with this chiropractor, because not all chiropractors are the same. There's some doctors like myself who really focus on athletes, an active patient base, and I also see a lot of pregnant women and some children. And then there's other chiropractors who focus on mostly a senior type population or a pediatric population. And then here in South Florida, there's also chiropractors who focus on auto accidents.
Absolutely. Now, do you also focus, and something you mentioned earlier, that you really focus on nutrition as well?
Very much.
How that affects spine health. Can you talk a little bit about that?
So the gut is the second nervous system. And when I am dealing with the health of the brain and the nervous system and natural pain management techniques, we do a lot of nutrition based on the anti-inflammatory diet in our practice. And in as little as 5 to 7 days, when you're eating an anti-inflammatory diet, you'll be able to reduce joint pain, muscle stiffness, digestive complaints, low energy, poor sleep, mood problems. And it's such an easy and non-invasive way to reduce pain naturally.
And does the same apply to exercise? Do you include exercise when you're seeing a patient?
I do in my clinic, because I find that healthy, active people, we have a saying in my clinic that healthy people heal.
I like
and
that.
so I find, thank you, I find that healthy, active people hold my adjustments better. And the goal in the end is not to see a patient forever. The goal is, #1, get the patient out of pain, and then #2, teach them how to stay well. And that would be in a well-toned, active body.
But I know many people, or I've heard of many people who love going to a weekly chiropractor appointment to get that back realigned. They feel great. It's sort of part of their well-being.
Yeah, I would love to meet those patients.
Yes.
I don't know them personally because I am what I call a treat and release chiropractor,
right.
which means that I treat people and I teach them how to stay well. For the patients who do go back on a weekly basis to see their chiropractor, they are likely going under a variety of different reasons. The first of which is when people have a permanent condition and they need maintenance to keep them feeling well and mobile and without pain, they have two options: either a medication that can disable them or cause other symptoms or problems, or go see a chiropractor, which is a very, very safe and drug-free option. And then there's other people who just feel that they have more soothing and health in their nervous system if they're seeing a chiropractor on a regular basis.
Absolutely. Now, coming up, a sedentary lifestyle often leads to bad posture and pinched nerves in the spine. So how can a chiropractor help? Stay tuned to find out. You're watching the Health Channel, all health, all the time on South Florida PBS. If you have a question, please call in using the toll-free number 855-796-4475. And please be sure to visit our website, allhealthtv.com, where you can watch a live stream of the Health Channel and watch videos from previous episodes. We'll be right back.
This is my kind of happy hour.
This is my kind of fast lane.
This is my kind of personal trainer.
My kind of joyride.
My kind of nightlife.
Whether you're just finding your stride or making the golden years look good, Florida Blue goes beyond health insurance, investing in the health and communities of all Floridians. So you can feel good saying, that's my kind of blue.
This is my kind of blue.
This is my kind of blue.
This is my kind of blue.
A concussion is a type of traumatic brain injury, or TBI, caused by a bump, blow, or jolt to the head, or by a hit to the body that causes your head and brain to move rapidly back and forth. This sudden movement can literally cause the brain to bounce around or twist in the skull, stretching and damaging the brain cells and creating chemical changes in the brain. What you might not know is that these chemical changes make the brain more sensitive to any increased stress or injury until it fully recovers.
This is the story of a boy who didn't talk for a long time. The boy liked things to always be the same. Any changes would scare and upset him. The unknown was an unfriendly place. The boy was very sensitive to lights and sounds. So he built secret hiding places where they couldn't get in. The boy didn't like looking people in the eye. He wasn't trying to be mean, it just made him feel uncomfortable. Sometimes he would flap his arms again and again.
One day I found out I had something called autism. My family got me help. Slowly, I found my voice and learned all the ways I could live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio, and we're talking about posture and mobility with Dr. Sandra Doman, a chiropractor at Miami Sports Chiropractic and Yoga Center. If you have a question, please call in using the toll-free number 796-4475. We're here to answer all your questions. So let's cover some basics about chiropractic care by going over the anatomy. So doctor, can you talk to us about the parts of the spine that you focus on with your patients?
So my favorite thing to point out when we're looking at a spine model is the neck, the mid-back, and the low back. Here are the healthy, natural, shock-absorbing curves of the spine. And so one thing I want to point out even before we go into the normal anatomy is that when people are slouched over, they're automatically taking out these natural shock absorbers.
Okay. So when you're talking about the makeup of the nervous system, the musculoskeletal system, what are you referring to?
Inside the cranium here is the brain, and then here are the individual segments, the vertebra of the spine, and in between each bone, there's something called the intervertebral discs. Those are the little mini shock absorbers. And so this is an area that can get pain in terms of the discs. And then back here, these little slit joints, they're called facets. And these are the little joints that can get locked and compressed together and become arthritic over time if they don't get adjusted. And then here are, in this tailbone area, these are the sacroiliac joints. These are the joints of the pelvis where the entire weight of the upper body and spine plug down into the pelvis.
So what's the difference, or what's actually the connection between the alignment and the nervous system?
Here, inside the length of the entire spine is the spinal cord, and out of these little holes called foramen exit the nerves that control every muscle, every organ, and every cell in the body. And so when there are misalignments in the spine, it's not necessarily that they're pinching a nerve in the traditional sense, but they're causing undue stress on the body.
Right.
And bodies under stress don't function well.
So, I mean, I guess the most common question is what's causing the misalignment to begin with?
What are causing misalignments are things like physical stress, sports injuries, auto accidents, and what I see most today, which are postural problems of people sitting in front of a computer and using their devices.
Oh, we're going to talk about that,
yes.
doctor.
Chemical stress, mostly through poor nutrition, which causes systemic inflammation. And then emotional stress, we all know that people carry a lot of emotional stress, and we tend to store that. We carry the weight of the world in our shoulders. And I also find people, when they're going through emotional events, they tend to have low back events.
We actually have a caller, doctor. We have Gerald from Davie. Gerald, are you with us?
Yes, I am.
Hi, how are you, Gerald? Do you have a question for the doctor?
Well, yeah, I had been seeing a doctor for about 15 years off and on, and he retired. And when he first started, he went from manipulation. He moved on to trigger point into what's called kinesiology. And I'm wondering if the doctor can explain the difference between those modalities of treatment.
Absolutely, and thanks for your question. As I mentioned before, chiropractors are expertly trained in not just using spinal manipulation in a variety of different ways, but also soft tissue techniques, as you mentioned, such as trigger point, and then what you ended with in the end, which is called kinesiology. It's important to understand that while people associate chiropractors with the cracking, popping sound of a joint release, there are also other non-popping cracking techniques that can work with the joints and the alignment of the spine, such as kinesiology, that use muscle testing and feedback systems to understand where to treat the patient. And so it sounds like he was using different modalities with you based on how you were presenting and what you would get the best outcome from.
Well, yeah, I found that, as he went from manipulation to trigger point, my need to return to him for adjustments, extended. When he went to kinesiology, I went from maybe once every week and a half to maybe once every 4 months to have him readjust me. And he retired, and I'm having a difficult time finding another chiropractor that uses kinesiology.
Okay, so I believe that there is a website that you can check out, the International Association of Applied Kinesiology, or an American Association of Applied Kinesiology, but that's the best way that you're going to find a chiropractor who practices those specific techniques that you had the best outcomes from.
All right. Well, thank you, because he told me early on he did an X-ray to check out what was going on, and he says he told me I have what's called a military neck because I didn't have normal curvature up in my cervical, and we figured out that was because when I was like 7 years old, I was sitting in the front seat of my father's 41 Buick, and he had to stop quick to keep from wrecking, and I slid off the seat, and my nose kissed the dashboard so bad it broke it, and we assumed that was from the point that I developed that military neck position, because my shoulders are always stiff. I can't get a full rotation on my neck to my head. I'm always limited because I have pain there.
Mm-hmm. So, and what you're describing is common. Lots of people suffer from something very similar, even from accidents that they had when they were small children. So number one, I'm glad you're okay. And number two, I'm glad that you found so much relief with a drug-free option like chiropractic. And I am hopeful that you're going to find another applied kinesiology doctor in your area.
Thank you so much, Cheryl, for your call. Doctor, if you mentioned kinesiology, can you explain what that is exactly? And using our model, can you pinpoint where it's used best?
Well, I would love to talk about applied kinesiology. It's actually one of the techniques that I do not practice. So to give you a very basic idea, again, we're still talking about improving the relationship between the physical spine as well as the nervous system, the communication between the brain and the rest of the body. So traditionally, while someone like me would focus on the physical joints of the spine and the soft tissue connections to release the imbalance between the spine and the nervous system, applied kinesiology typically uses muscle testing or vitamins or different items that can diagnose and show how they can fix these imbalances in the body.
Thank you, doctor. Now, posture. We have to talk about posture. We've mentioned posture, but it affects all of us, especially if you're sitting behind a desk all day on a computer. So talk to us a little bit about posture and spine health.
In my experience, I've been practicing for about 10 years now. Unless it's a sports injury, a pregnancy, an auto accident, what I'm seeing now these days is musculoskeletal pain due to people hunching over at their desks, the way they sit in their cars, and the way that they hunch over their smartphones. And even worse, I'm starting to see children with adult-style neck pain. I treat 6-year-olds in my office who have headaches and neck pain.
6 years old?
Due to device use, absolutely. And I see small children now. And so it's important to understand that the spine has these natural shock absorbers, and in any given moment of alignment, not even including the individual vertebra, we have a natural plumb line in the body. My husband calls it the vertical axis. This is the ear to the shoulder to the hip, knee, ankle. And so when you have people who are hunched in front of a desk, they could buy a beautiful $4,000 ergonomic chair with the best lumbar support in the world. And if it doesn't keep people in a neutral, aligned position, they're going to have musculoskeletal pain, and there is no pill that can help that.
Absolutely. Now we're going to talk a little bit more about that. But poor posture from texting or sitting at the desk all day can cause neck problems, as the doctor just said. So let's take a look at the growing pain of our digital age.
Text neck is a condition usually seen in younger people between the ages of 18 and 44. It's almost actually at an epidemic proportion. Up to 79 or 80% of individuals in that age range have difficulty with neck pain. And what they found when they look at the behaviors of those individuals is that they bring their head forward when they're texting, and they could text from 2 to 4 hours a day. Not all constantly, although some for more than 1 hour. And if I can show this position, they're in their phones like this with their neck bent about 60 degrees forward. And they're looking down the whole time, and before they know it, they have neck pain. We found that it's attributed, in many cases, to our high-tech world right now, whether it be a computer, a tablet, or a smartphone device. Complaints of patients with text neck is usually neck pain that's non-radiating in the back of their neck and up to the shoulders usually. They have shoulder pain and stiffness in their shoulder. So we want to try to make the device at eye level. Secondly, we want to try to limit the time they're in that position. So we want to have them take more frequent breaks. I know we're not going to curtail the habits of texting in this day and age and using the computers for extended periods of time, but it's important to break some of the habits, change position, have them take a break and get up and walk around and then come back to it so now they start to stretch. And then I often give them exercises to supplement that.
We actually have a clip of you, Dr. Doman, showing people how to do posture check. So let's watch that and then we'll discuss it a little later.
Right now, I'm going to teach you a quick posture check. Why is it important to periodically check your posture during the day? While you're leaning and typing over your cell phone or sitting at your computer, your head and neck can fall forward. And what you'll discover is that your headaches and your neck tension never go away. So here's a simple fix called the chin link. You're simply going to press the chin in, allow the forehead to drift back, and you're going to hold this position for 5 to 7 breaths to start. Isn't that simple? Just as I said, you're going to press the chin in, allow the forehead to drift back, and you're going to hold this position for 5 to 7 breaths to start. This is going to help condition the muscles in the front side of the neck.
So it's as simple as press back, let the forehead drift, I hold it for 5 to 7 seconds.
Or forever.
Or forever, because this is really good posture.
But if you're sitting here, I'll take 5 to 7 breaths.
You can't.
If you're sitting here, I'll take 5 to 7 breaths and recondition the deep neck flexors that are holding your neck and head over your body. These guys get very weak when we're sitting over our computers and phones.
And we've all been guilty of that. Now I'm going to be more mindful.
Yeah.
Absolutely.
And that's the good thing. That's the patient that stays well.
Okay, good. Now coming up, if food is medicine and medicine is food, what can we eat to reduce inflammation? Stay tuned to find out. You're watching the Health Channel, all health, all the time on South Florida PBS. If you have a question, please call in using the toll-free number 855-796-4475. And please be sure to visit our website, allhealthtv.com, where you can watch a live stream of the Health Channel 24/7 and watch videos from previous episodes. We'll be right back.
Thanks, Coach. Thanks for teaching me about teamwork and leadership.
Thanks for showing me that sports help me stay healthy and do well in school. And thank you for teaching me about concussion.
Letting me know that I should tell you if I think I have a concussion, and how to protect my head and brain. Because one day, I want to be a teacher, an astronaut, scientist, or a coach, just like you. Thank you for protecting my future.
Come on, kiddo. Do your homework, okay?
Oh, no. What are you wearing? Can you just go in the other room and watch your show?
It would be a shame for you to get sick at this time of year.
Is he okay? He's perfectly healthy, except I still need to write him a prescription.
Learn why the American Academy of Pediatrics now encourages doctors to write kids prescriptions for play. Go to thegeniusofplay.org.
A brain aneurysm can strike you when you least expect it, plunging your entire world into darkness. But if you know the warning signs, you're much more likely to survive. If you suddenly experience the worst headache of your life or sharp, sudden pain behind your eyes, do not ignore it. Please seek immediate emergency attention. It's time to shed some light on brain aneurysms. You gotta know the information.
The Lisa Colagrassi Foundation, lisafoundation.org.
Hello, I'm Dr. Agueda Hernandez with the Baptist Health Primary Care Family Medicine Center at West Kendall Baptist Hospital. Signs and symptoms of hearing loss are different for each child. If you think that your child might have hearing loss, ask your child's doctor for a hearing screening as soon as possible. Don't wait. Even if a child has passed a hearing screening before, it is important to look out for the following signs. Speech is delayed, speech is not clear, does not follow directions, often says, huh? and turns the TV volume up too high. Babies and children should reach milestones in how they play, learn, communicate, and act. A delay in any of these milestones could be a sign of hearing loss or other developmental problems. Contact your primary care physician if your loved one is showing any of these signs.
I was too young to get a mammogram, and I had no family history, and the lump was probably just nothing. At that point, I really pushed to get that prescription. My initial reaction when I was diagnosed is, oh my goodness, I'm going to die, and I'm going to leave my 2 young daughters behind. If I waited, I wouldn't be here today. Early detection is incredibly important. Know your body. Go into your doctor, get the mammogram, get checked.
Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio, and we're talking about reducing pain through chiropractic care with Dr. Sandra Doman, a chiropractor at Miami Sports Chiropractic and Yoga Center. If you have a question, please call in using the toll-free number 855-796-4475. We'd love to help you. Now we have a caller on the line. We have Doris from Hollywood. Doris, are you with us?
Yes, ma'am.
Hi, Doris. Thank you so much for calling in. You have a question for Dr. Doman?
Yes, I do. I can't pronounce it, in the wrist carpal tunnel or whatever. And, well, I worked on computers and typewriters all my life, and now I crochet. And I don't know, at my age, does it pay to have it operated on or let it go until?
Good question.
That's a great question. Thank you, Doris. So I'm sure whichever doctor diagnosed you told you that you have compression of the nerve here in your wrist, the carpal tunnel, and that can affect and cause tingling or muscle weakness in the first 3 digits of the hand. So something that you might want to consider is that this median nerve, it doesn't start here in the wrist, it starts all the way up here in the neck. And so depending on how severe your carpal tunnel syndrome is, if you still have reasonably good use of your hands and just a little bit of discomfort, before having a cortisone injection, before having a carpal tunnel release surgery, you might want to consider not just seeing a chiropractor who can help reduce some of the joint immobility and muscle tissue tension in your neck, but also starting to work on your posture. And there is no age that is too late to start working on your posture, to get your head back over your body and naturally take pressure off the nerve that goes down the arm into the hand.
Oh, okay. Thank you very much. You answered my question. I appreciate it very much.
Well, thank you, Doris, for calling in. We appreciate it. Now, I want to go back to something we were discussing before the break, which is the infamous text neck. We see it everywhere, and as you mentioned, we're seeing it younger and younger as we live in a digital world where we're connected to our devices. And as you were saying, that you're seeing this a lot in the younger population, correct?
So my concern for the younger population is that you and I, we didn't grow up on devices, and we ended up having musculoskeletal issues as we got older because we went through school or college and started leaning at our computers. My concern is that I'm seeing children as young as 6 years old with adult-style neck pain and headaches, and that's because they're growing up on devices. And so depending on what a parent thinks, I care less about their philosophy with regards to how much time that they want to allow their child to be on devices, so much as their rules for engagement. So for example, I have a 2-year-old daughter, and the very little bit of phone time that I give her, she knows that I have these rules that she has to be leaning against a pillow with a pillow on her lap, and I say heads up, hands up, which means that she has to have her elbows leaning on a pillow, and I need to see the ear over the shoulder, restoring the natural shock absorbers and alignment of her spine, that if she wants to be using the phone, that she is in good alignment so she doesn't develop these musculoskeletal problems while she's a healthy growing child.
Absolutely. Now, one of the other things that you do is that we have a clip of you using a decompression table for low back decompression, correct?
Correct.
So what exactly are we seeing here, and what is this used for primarily?
So this is one of my favorite chiropractic modalities. As I've mentioned before, and you can see it right here, There's many different ways to adjust the spine and restore alignment to the body. So what you can see here, I'm working at the Coach Larrañaga basketball camp at the University of Miami. And when I do these basketball camps, I ship my table down there because I do something called flexion distraction, and I combine it with a physical therapy technique called ART, active release technique. And so what you can see that I'm doing in that video is I'm using my hands as well as that moving table to gap and open these little facet joints. These are the little facet joints that can get locked and compressed together due to physical stressors, sitting posture, sports injuries, auto accidents, pregnancy. And so I'm able to gap and open these little joints. And then I also work around the sticky, painful, soft tissue that's locking onto these joints and potentially holding them out of place. So this is one of the non-cracking low back pain treatment techniques.
So as you're opening, what is it that you're doing as you open up these facet joints?
I am improving mobility and reducing pain, because the low back has a few different ranges of motion that most people don't have the opportunity of performing during the day. And when these individual segments can get locked in the thoracic and the lumbar spine, they can cause pain. So you have two options. You can cover it up with pain medication, or you can have a chiropractor gently open it, improve mobility, decrease the likelihood of re-injury, and decrease inflammation.
And you also have a tool that you use for this as well. It's called the activator?
Yeah.
Okay, so how does this work?
This is the activator, and this allows me to apply a chiropractic adjustment without any cracking sound. What they taught us in chiropractic school is when we apply a force, we have mass times acceleration. So hands would be mass, this is all acceleration. I tend to use this tool, it's very gentle. I tend to use this tool on children, senior citizens, people with osteoporosis, or really just people who don't like the cracking sound at a chiropractor's office. The good thing about seeing a chiropractor is we really have so many different treatment options. If you don't like the cracking sound, the activator or the flexion distraction table is a great alternative.
That's amazing. Okay, we're going to switch course now. We're going to talk about inflammation. We have so much to talk about. So inflammation is tied to a long list of serious chronic conditions, diseases, and many cancers. And Natalie Castro, the chief wellness dietitian at Baptist Hospital, offers some healthy tips. Let's watch.
One of the best ways to reduce inflammation in our body is by the foods that we eat. So one of the things that causes inflammation is processed foods, foods that are high in fats, foods that are high in sugars, for example. We're on the road a lot. We're trying to find that quick and convenience food, so foods that have been sitting on the shelves for a long time, things that are packaged and ready to eat. So instead, we want to try to bring back the plant-based foods, foods that are naturally found in the environment. They give you oxygen, so they reduce those free radicals. They're high in antioxidants, so they're full of vitamins and minerals that are very important to fight off that inflammation state that can occur in the body. The best way to get in those plant-based diets is, and especially when you're going shopping, is to stick to the perimeter of the store. Shop around the edges and avoid all that stuff in the middle where it's all the processed packaged foods that are ready to eat. And the best way to make sure that you're using your fruits and vegetables so that they don't go bad is planning your week's menu options of what you're going to be cooking and using the things that are going to go bad first so that you don't have a lot of waste at the end of the week.
This is actually really great advice, and I had no idea that what you put in your body can also be tied to your spine health. Is that something that most people don't realize?
Absolutely. So as you mentioned before, dietary inflammation is getting a lot of good attention right now with regards to chronic disease and illnesses.
Right.
And part of that is maintaining the health of your back. And so what I find in my practice is one day people wake up and they say, oh, I'm getting older. That's usually between 38 and 42. I call that the magical age of breakdown. That's when people wake up and say everything hurts.
Oh goodness, I'm 38.
right? Oh, so you're going to be eating a lot of vegetables right after this interview.
That's it, going straight to eat my kale.
That's right, all the kale, all kale all day.
All kale all day.
And so when you wake up one day at 38 or 45 and you hurt in places that you have never injured before, most fingers point to dietary inflammation.
Interesting.
And so there's certain numbers and types of foods that when you eat them, again, this is not a fat and calories conversation. This is a question of when you put food and information in your body, does it break down into the inflammatory chemicals that are creating pain in your body that we commonly take over-the-counter medications to then cut off, and we cover up the pain and think that we're healing something but creating inflammation.
So again, nothing to do with fat and calories, more about the breakdown of these chemicals.
Absolutely.
Okay. Wow, so now what are the foods that are causing inflammation?
So the big ones that I focus on in my practice are all grains and grain products. This includes white bread, whole wheat bread, whole grain, processed anything, any of the inflammatory oils, the hydrogenated oils, seed and legume oils, soy, dairy from grass-fed creatures, and meat and from grain-fed creatures, and meat and eggs from grain-fed creatures. These were the animals that were not kept under good
sanitation conditions.
Not good sanitation conditions, and they're feeding them wheat and corn and soy and trying to make them very fat very fast, and then people eat those foods and wonder why they are turning into the same.
And I imagine that anything highly processed as well, or drive-through and getting a burger, or I mean, that can't be easy also to just quit all that and to change. So how do we implement that in my practice? Because those changes, first and foremost, you have to have a person who makes the change. That's always the person who's going to have success. So in my practice, I do a 21-day program to help transition people onto eating an anti-inflammatory diet. And I use organic, dehydrated vegetable supplementation to do two things. Number one, keep them feeling full. And number two, to stabilize their blood sugar so that they can arrive at their next meal and make a healthy, easy decision instead of coming home from work and shoving whatever comes into their face. Which tends to happen.
Which can happen if you are on a blood sugar roller coaster. And if you're unprepared, and if you don't have the tools and you're not surrounded by lots of food, like what I have in my house. We have food. So I come home from work and, we're ready to eat.
Which is good. Now, I want to talk about that because we know foods that can cause inflammation. So let's get over the foods that you actually should be eating as well. First on that list, fruits and vegetables.
Definitely.
Yes. So the more fruits and vegetables, the better for your spine health too.
Absolutely, because that's going to be one of your number one pain relievers, even chiropractic. I have people that I've treated and I never even touch their spine, and they start to experience pain relief even before and without getting any therapy in as little as 5 to 7 days when they eat off this list.
Wow.
So we're talking organic fruits and vegetables, red and sweet potatoes, because this is not the no-carb diet. You need carbs to be alive.
Yes, carbs are our friends sometimes.
Yes, that's right. We love our carbs. Fresh fish that are wild caught, meat and chicken that are free range or grass-fed. Those were the healthy creatures before they ended up on your plate. You can have any type of raw nuts as well as their nut butter cousins, but that does not include peanuts, which are a legume highly inflammatory.
And we're going to actually, I'm going to interrupt you,
Sure.
Dr. Doman, but we're going to talk more about that. We actually have to go to a quick break. And the presence of pain often means that something is wrong. So coming up, the doctor goes over the difference between acute and chronic pain and how you treat them. You're watching the Health Channel. All health, all the time on South Florida PBS. We'll be right back.
Over the years, I have played some characters you could call controlling, but the truth is, there's so much in life we can't control. But here's something we can: colorectal cancer. It affects men and women, and it's the second leading cancer killer in the US, which is astounding, considering it's almost entirely preventable. Here's how. Most colon cancers start as polyps, and screening helps find polyps so they can be removed before they even turn into cancer. Screening also finds this cancer early, when treatment works best. For me, screening was simple and quick. It was no big deal, except for the huge sense of relief you feel afterwards. There are several tests that you can choose from. If you're 50 or older, you should talk to your doctor. Decide which one's right for you. But take control. Do everything you can to prevent colon cancer. Screening saves lives. It could really save your life.
I am a father and a husband. I'm a professional golfer. I am a colon cancer survivor. And I fight because I want people to survive what they're going through and live long, happy lives. It's the second leading cause of death of any cancer. Probably something most folks don't know. But it's also one of the most treatable forms of cancer. So you can prevent this by proactively doing things about it. And many times you're going to find out that it's to be a lifesaver to do that.
The day of my stroke started off at the office. I did get my blood pressure checked that day because I felt a little off, and it got worse, and I knew something was wrong. They put me in the back of the truck, and that's when I heard the transmission of white male stroke victim. I thought there was a good chance I was going to be dead by the time I got there. They took me to the Miami Cardiac and Vascular Institute, constantly reassuring me that I was being taken care of and I was in good hands. The message I would tell people about their heart and their body in general is definitely see a doctor, have a primary that can detect things early. A big milestone that I have achieved after the stroke is completing 25 years with the Miami-Dade Police Department.
We develop quality citizens who keep our core, our country, and our communities side by side on the winning side. Not for glory, but for honor. For a code that isn't written or spoken, but lived. It's what we do. It's who we are. It's the battle cry of our fighting spirit. Battles won. See all the battles Marines fight to win at Marines.com.
Smart lights, smart locks, smart thermostats. You love your new connected technology, and the Consumer Technology Association wants to help you protect the security of your devices. First, don't use default or easy-to-guess passwords. Create unique ones and keep them safe. Next, look for and install security updates from device manufacturers. Also, have an active firewall for your home router, and consider using a professional installer to set up your new devices. Easy tips from the Consumer Technology Association to help keep your devices secure.
Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio, and we're winding down this hour talking about chiropractic care with Dr. Sandra Doman, a chiropractor at Miami Sports Chiropractic and Yoga Center. If you have a question, there's still time to call in. Just call the number 855-796-4475. We'd love to hear from you. Now, the American College of Physicians developed guidelines on non-invasive treatment of low back pain. So they classify low back pain into 3 groups. So, doctor, take us through this graphic. What are the 3 levels of back pain?
Acute back pain is any incident that lasts and resolves in less than 4 weeks. Subacute is from 4 to 12 weeks, and chronic is anything that you've been suffering with for more than 3 months. And in the Journal of the American Medical Association, they came out with the new low back guidelines that your medical doctor is supposed to implement when you go see them for low back pain.
And there's subacute as well, correct?
Mm-hmm. Right, so that's in between bending down to pick up your shoe and having a massive back spasm and not being able to get up, but it can resolve very quickly. Mm-hmm. And in between, I had an auto accident and I still have pain a year later. So that's what subacute pain is.
Okay. Now, Dr. Doman, we have a caller. We have Armando from Hialeah. Hi, Armando. How are you?
Oh, yes. I want to ask about a book that I read. It's a young book written by a chiropractic, and the author's name is... let me look it up here just a minute. His name is Frank R. Young, D.C., Doctor of Chiropractic. Are you familiar with yoga tonics?
I'm not.
Well, that's what the book teaches, okay? And I've had it for a long time, and I found it very effective. Okay, because he in his book he says that he takes out the dangerous poses from yoga and combines it with the with some chiropractic approaches. You know, to what do you call it? Some type of physical intervention that chiropractics do.
And Armando, that's helped you?
Yes, it has. I've had the book since the 70s. It's an old book, okay?
Wow.
I don't know if the author is still alive, but he wrote a lot of books on the Parker Publishing Company, and the book is called Yoga for Men Only. Frank R. Young, D.C. He also has a yoga book for everybody, okay? It's called Secrets of Yoga, the other book.
You know what? We're going to have to look into those, Armando, but I appreciate you calling us and teaching us something today. Thank you so much. Okay, I want to talk about the person who's in acute low back pain.
Sure.
What kind of treatment do you have for that?
So when it comes to somebody who has acute low back pain, number one, they need a proper diagnosis, because patients can come in and they could say, I have a muscle spasm, it's all muscular, or I think I have a pinched nerve. So when you go see your chiropractor, we're going to perform an orthopedic, neurological, and chiropractic exam to determine what's causing the acute pain. From there, we can choose the best modality to help you get out of pain. So number one, based on the low back pain guidelines, you can try superficial heat. Some other good options for acute low back pain are spinal manipulation, acupuncture, and I would definitely stick with superficial heat.
When you say spinal manipulation, we had a caller who mentioned spinal manipulation. Is that when you physically go in there and straighten the spine?
So spinal manipulation, we call it the chiropractic adjustment, but that is when we are hands on the spine to improve the alignment and decrease pain, improve joint mobility and decrease inflammation.
So that's acute back pain, low back pain. But what about if someone has that chronic pain that we were talking about? Something that lasts well beyond years. How do you manage that?
So in my clinic, the way that we manage chronic low back pain, which is a lot of people that we see at this point, you know, low back pain is an $80 billion a year industry in the United States.
Wow, incredible.
When you are dealing with chronic back pain, you're also dealing with a heavy emotional and sociological component. You know, when you are in pain and you are losing quality of life and potentially becoming disabled, there's also an emotional component.
Right, you often lead to depression, anxiety.
Depression, anxiety, and belief systems about your body's ability to heal, especially if you have not been finding good answers for your back pain. And so in my clinic, aside from mixing all the natural therapies, which include chiropractic, acupuncture, cupping, trigger point therapy, nutrition, we also have a yoga center, and so we're able to use, like the last caller who just recommended, we use yoga that is safe for people who have musculoskeletal injuries, and then we're able to teach them about different meditation and stress relief techniques that they can use in their personal life, and also addressing their belief system regarding their ability to heal.
So Dr. Doman, if a patient's coming to you, are they usually coming from a referral from their doctor?
So my practice, it comes from two different locations. Number one, word of mouth, which is also how I recommended. This is the best way to find a chiropractor is from people in your community and word of mouth. And the second come from medical doctors. I've been working a lot with OBGYNs since practicing here in South Florida. Pregnant women can get low back pain, sciatica, pubic bone pain, and these are great referring doctors because they don't want to give them medication.
Absolutely. Now, chiropractic care is non-invasive, so seeing a chiropractor might reduce surgeries or medications, as we just noted. So talk about the benefits of patients who see a chiropractor over, say, a patient who doesn't see a chiropractor.
So one interesting statistic, about someone who sees a chiropractor even versus a surgeon for their low back pain is that there has been a study done in workers' compensation with regards to injured workers. And for injured workers with low back pain, if they present to a chiropractor first, they only have a 1% chance of ending up in spine surgery, versus a 42% of ending up in spine surgery if they see a surgeon first.
And now, before we wrap, I do want to bring up yoga, because you also have a yoga center with your chiropractic care. So how does yoga fit into the picture?
Yoga fits into the picture going back to how I discovered yoga, which is that I had back pain 15 years ago. And when I went to the chiropractor, I got about 80% better. And it wasn't until I discovered yoga and why it worked on my body to help balance out the muscular imbalances and also teach me these relaxation techniques that I was able to hold the adjustments and not just be without pain, but I also learned how to stay well. And so that's how we use it at my practice. As an elective for the patients, they can either choose or not choose to do the yoga. But if they're looking for something to supplement their lifestyle to not just keep them out of pain, but reduce stress and stay well physically, the yoga that we practice at my clinic is based in physical therapy and posture techniques and different postures that are safe for people with pre-existing orthopedic conditions.
And as well, it's so great to wake up those muscles in a healthy way, stretch, correct?
Yeah, chiropractors, we really want to keep people well. That's really our #1 goal. And yoga helps me do that with my chiropractic patients.
I love it. Thank you so much, Dr. Doman, for being on the show today. Fantastic show, so much great information. So be sure to join us next time on the Health Channel. All Health All the Time on South Florida PBS. And follow us on Instagram, Facebook, and Twitter at All Health TV. And please be sure to visit our website, allhealthtv.com, where you can watch a live stream of the Health Channel and watch videos from previous episodes. I'm Kathy Buccio. We'll see you next time.